Hello.
Hi.
Hi. My name is Ngoc. I'm your nurse today. How are you?
I'm doing alright.
Okay. For your privacy. Can you tell me your name?
Johnny Stokes.
Okay. How do you feel today?
Kind of hard, but I know I'm going home today, but I'm kind of tired, that's all.
Okay. Let me see you. Okay. Check the medical record. Alright. Can you tell me if you have any allergy?
No allergy.
No allergy? Okay, that's good. Let me, do you have any pain? From a 0 to 10, 0 is no pain, 10
It's
is the
about
worst.
4
A 4? Where is
Yeah.
the pain?
on my incision and my chest.
Okay. Okay, let me take a look, okay?
Okay.
Let me lay you up a little bit. So it's exciting to go home, huh? Are you,
Yeah.
you have any help at home?
No, that's my problem.
Yeah? So you living by yourself? With no help?
Yeah, I live by myself.
Okay, so have you arranged anybody or any help at all?
No, not yet, but my
Check you.
son who is visiting here today, he might talk to the social worker.
Okay, so yeah, let me find out if I can give you any information with the social worker so they can find um, the helper for you. Okay.
Okay.
So you feel pain here? When is this pain?
Yeah, when you touch it there, it's kind of tender.
Tender?
Yes.
Okay. Check the temperature. It's kind of warm here. Alright. So it's a little warm, and let me check your pulse. You mind if I move you? Your incision.
So you're taking the pulse now?
Yes, I'm touching the pulse. The Peter, Peter, Peter pulse.
Okay.
Kind of weak. So let me find out if any infection going on. Okay. At the same time, I'm gonna assess your heart and your lungs. Okay.
Okay.
Have you walked yet?
Say that again.
Have you walked today?
Yesterday I did. My nurse,
Okay. You haven't walked today yet, right?
not yet.
Okay.
It's still early.
Okay.
It's
So
about
in a
7:30 right now.
okay. And then later, after meal or something, we'll get you up and walk. Okay.
Okay.
Yeah, listen to your lungs. saturation is a little bit high, so I have to definitely to check with the doctor to see if any infection going on, okay, and we give you medication and all that in a little bit, okay? So you're right. How do you breathe in? Did you exercise breathing with the intensive spirometer?
I did. I hate to use that because it hurts my chest. It hurts me when I take a deep breath for that.
I think you have to do that to practice your lung breathing. If it hurts, then we can give you pain medication. Okay.
Well, thank you for telling me.
Okay. So you need to use at least like 3-4 times a day. Okay. So why don't you go ahead and do it now while I'm here, and then while I'm checking your what is this, your incision right here in your leg to see if I need any dress and chain, okay? So I'm checking
Yeah.
the
And it hurts when you touch me there,
yeah?
nurse. Yeah.
Okay. It's a little bit, the drainage is a little bit of series synchronous, so it's a little pink, so it's not. Okay, let me go ahead and.
So it's still draining then?
Yes, a little bit. It's not bad, but I guess I have to do the dress and chain for you today, okay? And also, let me check your other drainage.
Okay.
And have the drainage.
Do you know what was my blood sugar the last time? Because I have diabetes. I'm just worried.
Oh, okay. Let me check
Did-
on the.
Did the nurse tell you? Maybe she forgot to tell
Okay.
you.
Let me check with her again, and then after that, how do you feel right now?
I feel like, it's really tight on my incision site,
Okay.
and it feels painful.
Okay, let me go ahead and call the doctor to prescribe any pain med, and we're gonna do the lab. We're gonna draw the lab for the evaluation, okay? You have any question?
No.
Let me go ahead and change the this incision, and then I'm gonna call the doctor, okay? For your order for your lab, and then we're gonna do further evaluation to see if any medication or any antibiotic that you need to for your pain or for your to prevent any infection, okay?
Okay.
In the meantime, would you like me to have your bed a little high like this, or you want to lay flat?
That's fine for me. Yeah.
Okay. So don't forget to do the breathing practice. That will help you with to keep your breathing at normal, okay? And keep your lung not to collapse, okay? And if you hurt, I can give you the pain medication. Would you like that?
Yeah.
Okay. So let me go ahead and call the doctor. So what is his blood sugar again?
About 200.
200. Okay.
When I was in the hospital last year, I was in an isolation room, and I think I remember the nurse said I have MRSA.
Last year you say?
Yeah.
So you have a previous MOSA. Okay, thank you for telling me that. So, so your blood sugar, I checked with the nurse, it's 200. So let me give you the insulin. So it's It will lower your blood sugar down. Have you had anything to eat yet in the morning? Have you had your breakfast?
I did.
You did? Okay, so you just have your breakfast. So maybe the blood sugar a little high. So I will check this again um, after 30 minutes of your meal to
Okay.
see if anything changed, and then I will give you insulin. Okay. To give you something to lower your blood pressure. In the meantime, I will call the doctor to check for the for your if you have any infection because you previously have the monster in the history. Thank you for telling me that. I'm gonna be back in 5 minutes. I'm gonna call the doctor. Okay.
Okay.
Hi, Dr. Lopez. My name is Ngoc. I'm the nurse for the patient, John, John, John Stocks, and he had his blood pressure is 125 over 82, and right now he have his respiration is 26, and
Okay.
he had the his incision both in his leg and his chest is kind of warm to touch, and he had pain is 4, and then the drain is on his leg is still like little pink synchronous, serious synchronous. So I would need also I need the order for him to have pain medication when he using the breathing practice on the intensive thermometer.
You're saying there was no pain medication already?
He had pain medication at 4 o'clock.
And you cannot give that yet?
Right now it's only like only 3-4 hours, so I don't know what is the order to in between the medication.
Well, check if it's every 4 hours.
Okay, so this maybe about due. And also, do we need the lab for him to see to check because he had a history of MRSA, and then all of his 2 of his incision is kind of warm to touch, and his pulse is like a 1 on his peripheral distal pulse, and his incision is seem like infection going on. So would you need the lab to order?
What surgery again did they do on him? Did you tell me earlier what kind of surgery?
He had the cabbage and then the catheter. He had the
Catheter?
yes, on his right leg, cardiac cath, and then the cabbage on his chest.
That's
It's the oh, okay. Oh no, I'm sorry. The vein he has is on his lower leg, so below the knee. So probably it's not the calf. It's not the hard calf. Okay. Okay. So he's still on antibiotics. So every 4 hours for pain medication, and I'm not sure if he's still on. I don't have any of his files. I didn't. Let me go ahead and check his temperature. Yes. I do the 4x4. Yes. Okay, so the antibiotics again. Sorry, can you repeat the IV? Mara, okay. IV 2 gram, okay. Okay, to 12. Okay. And then if in pain, just give him pain around the clock. Okay. And then culture for his wound. Okay. All right. Thank you, doctor. Thank you. Bye bye. Hello.
Yes,
May I come in?
sure.
Hi, I'm Ngoc. I'm coming back for you again. I did call the doctor, and then I have to check I'm gonna check your temperature, and you're on antibiotics he had for you, so he ordered the IV for you, Metra.
Okay, the
Metro.
temperature is 101.
Okay, so your temperature is 101, so the doctor ordered that you have 2 gram of antibiotic every 12 hours.
Okay, you
Okay.
can stop now. No.
Thank you.